HD-ICG is an addition to the suite of technologies incorporated into the ODM Plus for cardiac output monitoring, which includes the esophageal Doppler, a widely validated technology measuring central blood flow velocity directly. The arterial waveform analysis component of the ODM Plus, using the most reliable algorithm to derive flow from arterial pressure and calibrated by Doppler cardiac output. And now high-definition impedance cardiography, a completely non-invasive technology suitable for monitoring awake and lower-risk patients. HD-ICG is incorporated into the ODM Plus via the Q-Link interface box, connected via the USB hub. From the no-probe connected screen on the ODM Plus, simply press the HD-ICG button to enable monitoring. The electrode packet contains an RFID tag, which when placed briefly on the USB hub, provides 24 hours of patient monitoring. HD-ICG is a completely non-invasive technology and measures stroke volume via the transmission of a low-magnitude, high-frequency electrical signal through the thorax. 6 electrodes are applied to the neck and the torso. 3 of these, the white, the blue, and the green, are impedance electrodes. 2 of them, the red and the orange, are ECG electrodes. And 1, the black, is both an impedance and ECG electrode. Always connect the electrodes to the leads before placing on the patient to prevent discomfort. To ensure a good signal, shave the chest if the patient's very hairy. Wispy hair tends to be okay. Abrade the skin with the supplied new prep via a paper towel or swab. Clean off any excess new prep. Ensure the electrode gel has good contact with the skin. Pinching the outer adhesive areas of the electrode to allow the gel to contact the skin first is a good method to achieve good contact. And the electrode gel areas cannot touch, but the adhesive areas can overlap. An unacceptable signal is most likely caused by inadequate skin preparation or by poor positioning of the electrodes. Before obtaining any stroke volume measurements, calibration must be performed. For this, the patient must be still, quiet, and free of physical contact with others. Press the Calibrate Stroke Volume button. The system requires a period of 30 heartbeats for calibration, and a banner will flash during this period. Calibration is complete once systolic and diastolic pressures have been added. If the patient has any arrhythmia, the average of 3 readings should be used. Note that the technology only needs recalibrating at the beginning of the 24-hour monitoring period, but it can be repeated at any time if unsure of the results. And it's also important not to rush the calibration. Allow the waveform to settle both before and after. This is an example of the HD-ICG signal and its relation to ECG. Red lines should indicate the R wave of the ECG, and red, turquoise, and yellow boxes correspond with certain features of the HD-ICG waveform. HD-ICG is especially suited for use in lower risk and awake patients, however there are some limitations associated with the use. Diathermy will interfere with the HD-ICG signal and cause erroneous calculations. The signal should resettle 30 to 60 seconds after diathermy is finished. Any intervention which disturbs impedance, such as metal retractors or surgical instruments in the chest, steep head up or head down tilt, or a large amount of fluid in the lungs may affect the accuracy of the HD-ICG readings. HD-ICG cannot be used with left ventricular assist devices, but it can be used with pacemakers, using an alternate electrode position, autodefibrillators, chest drains, and it can be positioned around wound dressings. So to summarise, the ODM Plus now includes 3 technologies. The esophageal Doppler component is the best in class for perioperative fluid management. The arterial waveform analysis component is the best in class algorithm for deriving flow from arterial pressure. And the HD-ICG component is the best in class impedance-based technology. HD-ICG is a great non-invasive alternative to esophageal Doppler and arterial waveform analysis, suitable for monitoring lower risk patients and awake surgical patients. We hope you've enjoyed this module on high definition impedance cardiography, and if you haven't already, please see the previous module, An Introduction to HD-ICG. For further information, please contact marketing@deltexmedical.com.